Dr. George Lockwood, and I'm on the executive board of the International Society of Schema Therapy. And I'm talking today with Dr. David Bernstein, who is a professor of forensic psychotherapy at Maastricht University in the Netherlands. And he's also vice president of the International Society of Schema Therapy. And David is going to be giving an invited keynote address at the fifth ISST World Conference to be held in New York City this year, and is also going to be giving a pre-conference workshop. And the invited keynote address is on reparenting the psychopath. Is it possible and does it matter? And then the pre-conference workshop is going to be on the schema therapy with children and adolescents. So what I'd like to do today, David, if you could give us a preview of some of the things you'll be talking about in both of those areas. And if we could start with work with the psychopaths. And I know you've been working intensively on this over a number of years now. So if you could talk a little bit about some of the things you've been discovering in work with the forensic populations.
Okay. Well, you're right. We've been working now since 2005, 2006 on a large-scale project here in the Netherlands, really addressing the question of whether we can successfully treat forensic patients, criminal offenders who are being seen in forensic hospitals here in the Netherlands, including some patients who have up until now been considered to be untreatable. The patients that we focus on are patients with cluster B personality disorders. So these are patients who have an antisocial, a borderline, or a narcissistic personality disorder. And by virtue of the fact that a judge here in the Netherlands has concluded, based on psychological evaluation, that their crime was at least in part due to a mental illness, in this case personality disorder, that in addition to a prison sentence, they are sent to a forensic hospital for intensive treatment. And that treatment includes psychotherapy. Now, there's this extensive system of forensic hospitals called TBS clinics here in Holland. And there's quite good evidence that patients who go into these hospitals come out with a lower risk of recidivism compared to similar patients who go to prison. In other words, their chance of committing offenses or specifically violent offenses is lowered. But nevertheless, there's still a group of them who are at high risk. And these are the people who have the most severe personality disorders, including psychopaths, right? So psychopaths are the people who we traditionally think of as not having a conscience, people who lack empathy, people who lack remorse, people who are highly manipulative, skilled at reading other people and conning them, people who can be quite predatory in terms of the use of violence. They don't seem to care about the consequences of their acts. And so, understandably, there's been a lot of skepticism about whether people like this can benefit from treatment. And so we're flying in the face of accepted wisdom, and we're trying to see whether schema therapy can actually help some of these people.
Okay. And you tell me what you've been finding out in terms of the use of limited reparenting, because that's one of the things you'll be focusing on, and as in using that process to be able to reach them and get past what the walls they may put up.
Yeah, well, again, the common wisdom is, well, there's no point in trying to really establish a therapy relationship with a psychopath. Because there's nothing to form a relationship with. These are people who are completely emotionless. And so if you think you're going to do that, all they're going to do is kind of con you and trick you and try to use whatever you're doing to their advantage. We've made some observations that suggest otherwise. It's not that these patients don't represent a risk or that you don't need to be cautious with them in certain ways. But one of the things that we've noted is that they seem to be capable of certain emotional states like vulnerability under certain conditions. And this, again, really flies in the face of accepted wisdom. So we have many instances of patients in our study who, when their vulnerable emotions are touched, will break down crying. or will show vulnerability in other respects. It's not that it's easy to reach them. It's not easy to reach them. But we're increasingly convinced that probably the majority of people who are now classified as psychopaths have some capacity for vulnerable emotions. And so, what schema therapy attempts to do is to, we recognize that these are patients who, in many cases, have never been able to form a secure attachment. They tend to be highly mistrustful. And so the focus on the therapy, particularly in the first year to a year and a half, is on forming an attachment relationship, helping the patient to attach to the therapist. And the way that we do that is persistently calling attention to his attempts to keep emotions at a distance, and also starting to also call attention to the side of himself, in fact, that's more vulnerable. When it comes right down to it, many of these patients have experienced severe trauma growing up. Many of them have been abused. Many of them have been neglected or been abandoned. And what's fascinating is if you take a look at their crimes, and we're doing a study now on reconstructing the crimes of many of these people, that if you look in the sequence of events leading up to and culminating in their crimes, it often begins with an event where their vulnerable side is triggered. A girlfriend leaves them, something happens to them, they're down on their luck, everything they've tried is going wrong. Or someone betrays them, or they feel that they're being betrayed by someone. So from a schema therapy point of view, emotions like, or schemas like a mistrust abuse schema, an abandonment schema, an emotional deprivation schema are triggered. And so we see this as being the starting point that then leads them down a path toward using violence as an attempt to, if you will, cope with their vulnerable side being triggered. And so what we believe is that if you want to reduce their risk of violence, you need to reach the vulnerable side of these patients and then begin to heal them. And it's a tough go, but what we do is we prepare our therapists for that. We teach them the techniques that they need to use to confront the detached side of the patient, this empathic confrontation, to confront other sides that the patients use to keep distance, like let's say a self-aggrandizer side or a bullying side, and then to flip or switch the patient into more vulnerable states. And what's remarkable is that in many cases in our study, it seems to be working.
Yeah, it is. That's really something. So underneath the callousness is a lot of feeling, and through that is the capacity to be able to connect in a deeper way and get through those.
Yeah, and that's also our theory, which is that if you want to help somebody develop empathy, then you have to have some kind of breakthrough to emotion. Psychopaths, research shows, can read people's emotions fine. They know what other people are feeling. They just don't feel those same feelings, right? So in other words, the psychopath may be well aware when somebody else is feeling vulnerable, or that person is feeling sad, or when somebody else is feeling afraid. They may recognize that, but it doesn't touch them. They don't allow themselves to be touched by it.
Yeah.
So our idea is that if you can break through that distance, that callousness, and help to reach their vulnerable side, that they may actually develop more capacity for emotions like empathy, guilt, and so forth, more the so-called moral emotions.
Yeah.
And we see there's a lot of literature suggesting that it's those moral emotions that for most of us serve as a brake on aggression. That if you're mad at somebody and then you see the look of fear on that person's face, all of a sudden you're shocked. You go, oh my God, I didn't mean to scare you, or I didn't mean to hurt your feelings. And so if you want to prevent people from acting out in a violent way, you have to help them to start to be more in touch with those kinds of feelings. That's what we're attempting to do.
Yeah.